The premier event for infection prevention and control is coming to San Antonio this June. FAPIC's annual conference brings you the latest research, innovative products, and practical knowledge to help you prevent infection. From inspiring keynotes to thought-provoking panel discussions, FAPIC 24 curates an extraordinary platform for knowledge exchange. Meet IPs from around the world who face the same daily challenges as you. If you work in infection prevention and control, you don't want to miss this event. Learn more and register to join us in person or virtually at annual.apic.org.
You're listening to the 5-Second Rule, brought to you by FAPIC, the Association for Professionals in Infection Control and Epidemiology. Together with our nearly 16,000 members, we strive to create a safer world through the prevention of infection. Join us while we talk to infection preventionists and other experts to learn the truth about some common myths related to the risk of infection and to get tips to keep yourself and the people around you safe from infection. Welcome back to another episode of FAPIC's The 5-Second Rule. I'm Silvia Quevedo, your host. We have so many things to cover on the 5-Second Rule that relate to infection prevention and control, and we talk so much about what FAPIC's members do. This episode is how you can become an infection preventionist, how you can consider this as a career option and share it as a career that is exciting, certainly rewarding, and no question critical. So to help us, we have two FAPIC members, and they are going to share their experiences, their knowledge, and some of the work that's underway to promote infection preventionists as a great career. We have Chaz Rhone, who is an infection preventionist. He's currently the division manager of infection prevention and control for HCA Healthcare North Florida Division. Chaz actually has a Master of Public Health and Epidemiology from the University of Florida, and he started out way back in 2007, and he is certified in infection prevention and control and happens to be a fellow of FAPIC. So welcome, Chaz.
Thank you.
Chaz, you're not alone because you're with Dr. Rebecca Bartles, who is the Executive Director of Infectious Disease Management and Prevention for Providence Health. Rebecca Bartles has a doctorate in public health, and she is also certified in infection prevention and control and is also a fellow of FAPIC. And we're going to talk to both of you about your career journey, but want to welcome you as well, Dr. Bartles.
Thanks, Sylvia. Also happy to be here.
So is it okay if I refer to you as Becca?
Please. Yes, please.
Okay. But don't forget, Dr. Rebecca Bartles. We're going to go by Becca today. Okay, so let's just get right to it. You both are very involved with FAPIC, and among the many things you're both doing is you're serving on FAPIC's Academic Pathway Task Force. And Chaz, I'm going to start with you. Talk to me about your involvement with FAPIC's Academic Pathway Task Force.
Sure. So I'll just start off by saying Becca and I are both co-chairs for that task force. And I think we were selected because we both kind of come from a similar educational background. And, Becca will have an opportunity to tell her story. But we're both from the public health background, and we certainly understand how much of a challenge it is for someone from our background to break into infection prevention, let alone rise to a position of leadership in infection prevention. So I think our passion to help others recognize the skill set that Master's in Public Health Epidemiology prepared candidate brings to the table. I think the passion, to get the word out there, not only to people from our educational background, but to the people who are hiring infection preventionists is part of the reason why We are loving being involved with this very important work. Feel like it's going to change the future of our profession. We're working on a lot of different things with a lot of different entities to really get the word out there, not only who infection preventionists are and what they do, but the educational backgrounds that they can come from. So we're leading a team of several IPs across the country, both a few years experience all the way to very skilled in infection prevention, just drawing on their expertise and, helping really shape and guide how we can make infection prevention into an actual career path, starting with an educational degree all the way through getting employment and, becoming an expert in the field.
So that's a lot, and that's fantastic. And I did want to start by highlighting the academic pathway because it is relatively new for APIC to create. And I want to break it down for because there's a lot there, Chaz.
Yeah.
So I want to get to all of that. But let's start, Becca, if you could just help our listeners understand what it is as succinctly as possible, because just to give our listeners an understanding of who and what an infection preventionist is and does. Just broad brush.
Okay, that's a difficult task actually, because there's so much. IP covers, really a little bit of everything that happens in the healthcare setting. We're sort of, a jack of all trades and experts about all sorts of things. But in a broad brush sort of way, the true goal of an infection preventionist is to prevent the spread of infectious disease within the healthcare setting. We do that through education, teaching folks how to use PPE appropriately, hand hygiene, et cetera, creating policies that really help to mitigate the risk of transmitting infectious disease. We also have a strong role in surveillance, which is paying attention to disease trends, identifying patients that may be infectious, ensuring they're isolated, et cetera. And then if trends do exist, putting factors or putting strategies in place to stop outbreaks and prevent them moving forward.
Yeah, and that's a lot. And certainly if you're a regular listener to the podcast, many of you have a sense of this. But again, it is to stop or mitigate the transmission of disease and certainly to track the trends in infections and, as you said, doing surveillance. But it is a varied job, right? You don't walk into your workplace and do the same thing every day. So it's sounding like there are a lot of knowledge areas and skills that one might need. But before we get to that, Becca, you mentioned healthcare setting. And so we're talking about the entire healthcare continuum, correct?
Correct. Yes. Everything from, the ambulatory care setting, acute care, long-term care, behavioral health, anywhere that a patient receives care, or really anywhere that supplies and equipment may be stored for us to utilize when distributing care.
So before we get into all of that, just because I can, because I'll bring up that APIC as an organization is looking at expanding the role of infection prevention beyond healthcare. And, we've done a few episodes looking at infection prevention and control in educational settings. So before we get into the nitty gritty, Chaz, I'm going to go to you and ask, what are your thoughts or what are you seeing, or has there been discussion? Okay, that's a lot of questions. With the academic pathway about this issue of infection prevention and control outside of healthcare?
So I wouldn't say we've specifically discussed it on the task force, but I can tell you, just in passing conversation with other IPs in any task force or any meeting that we're having, it seems to come up, and especially because of the pandemic, I really think it's highlighted the need for infection prevention and control outside of the healthcare setting, because obviously we know germs are not just in the healthcare setting, they're everywhere. So, you mentioned educational settings, anything like that. So, we really were needed. I know of an IP. I remember on the APIC conference, she mentioned that she worked at Netflix, and there were more questions
Oh, wow.
about that than there were about, her presentation. I remember being sent a job, asking if I was interested to work for a cruise line. So there are
Wow.
all kinds of companies that are trying to get things back on board after the pandemic, but they need our help and they need our skill set. So,
Wow.
people are talking about it, and it is a hot topic right now. So, very
Super
exciting.
exciting. So if you're listening and you don't know what to do or you want a second career, keep listening. And actually, that reminds me, we did an episode about, understanding the similarities between yogurt and beer making and infection prevention and control. And Dr. Tim Wimpkin, one of our guests, he actually did some work for a brewery. So, because you got to you got to control the lines. So that's kind of cool. So let's talk about what is it that you have to do to become an infection preventionist, and where do most infection preventionists come from? And let me just reference that back in June 2017, the American Journal of Infection Control did an article about some APIC mega survey data. That's Reese and Gilmartin article from June 2017, indicating that the majority of infection preventionists back then came out of the nursing field, 10% from laboratory science, and 5% from public health. Now, I will say we're awaiting the latest data, but I'm going to go to you, Chaz, again and say, is this trend something that we continue to see? Where do most IPs come from still? Is it nursing?
Yeah, and it really depends on where you are in the country. Obviously, some states and programs are a little more progressive, so they certainly understand, again, uh, the backgrounds that can be infection preventionists. But traditionally and typically, I think we're mostly still made up of nursing. But I would be willing to guess when that new data comes out, you'll see probably a pretty good bump up on the public health and lab backgrounds towards that percentage as well.
Okay. Now, I think what's interesting, and maybe Becca, you can help explain this, and well, Chaz, you too. When we talk about infection preventionists, there is no specific degree requirement, correct? Or there's no minimum degree, as in you need to have at least a master's or a bachelor's. Becca, any insight into, if someone's listening, what degree should they get? Is there a minimum degree requirement? Where are we with that?
Yeah, this has been a sticky sort of gray area for a long time, because the field of infection prevention has grown and changed so much over the recent years. I think that historically most infection preventionists were trained on the job, because there were no prior to a few years ago, there were no degree programs where you could get a bachelor's or a master's specifically in infection prevention. That is changing, and that's part of the work of the academic pathway, is to create the content for clarity around what needs to be in a degree program, both at the bachelor's and master's level. There are programs now in the U.S. where you can get a master's in nursing and infection prevention, or a master's of science in infection prevention, or even a certificate in infection prevention epidemiology. But I think Predominantly, we are still seeing folks coming in, as Chaz said, from nursing, public health, and in the world of micro. All of those degree fields bring sort of pieces and parts of what an IP needs to the table. And so coming in from any of those degree fields, you likely won't have sort of the comprehensive perspective that's needed and the comprehensive expertise that's needed to be an IP. And so there will need to be additional on-the-job training or training through the programs that APIC offers, things like that. And although our folks primarily come from those three degree backgrounds, we also have individuals from other areas within health sciences. I have a member of my team that actually has a psychology background, but worked in the world of public health for a long time and is, an incredible expert and certified, et cetera. So it's not a one-size-fits-all model for sure. But I think as we build the degree programs and the curricula, that we'll begin to see those programs popping up across the U.S. and the degree or the pathway is going to become much more clear.
And Chaz, what do you think about that?
Yeah, I totally agree with that. And I think even outside of people with a clinical skill set or educational background, I mean, we're starting to see teams composed of people with project management skills or operational skills. So, while their skill set may not be specific to infection prevention, the tools that they're trained to use, we do need those in infection prevention. So we're responsible for managing projects and quality improvement, fixing processes that are broken. And while that is part of our training, I would be willing to venture that most IPs are behind when it comes to that. So adding people with a strategic mindset to the team, that really helps too. So we're finding people that are connecting with infection prevention as a career path just at the periphery because they can provide those skills that we may not necessarily have, but we still need to be successful in our things that we're trying to do in the facility. So,
Chaz, that's a good point too, that we're beginning to see as our field grows specialization within the role of infection prevention also. And, roles like surveillance specialist, somebody that focuses specifically on that aspect of the job, program management and project management, like you said. As the role continues to grow and become more complex, we really do need those kind of subspecialties.
So let me ask you, because Chaz, you alluded to this early. There's some controversy there. I certainly have heard it in my work at APIC around, maybe controversy is too strong a term. Let's call it a discussion around having a clinical background. So understanding the patient, the resident coming in with, a condition versus someone who, as you started to mention, Becca, maybe has the project management, quality assurance, surveillance background, public health background, but may not have, sort of the bedside clinical background. Talk to us a little bit about that discussion.
Yeah, so I've definitely been a part of those conversations. When I started my career, I've always been on a team that's a mixed team. So you'll have nurses, and then you'll also have people with a public health background, such as myself. And I've never felt alienated or looked down upon because of the skill set that I bring. I actually was hired into my first role because they were lacking some of the skill sets that I would bring to the team. So even though I didn't have a clinical background, I didn't work with patients or anything like that, they recognized the need to use their data to drive change. And so that's what really got the medical director's attention. They actually asked for a nurse in the job description, the application, but I applied anyway. So just kind of sharing that tidbit, just do it anyway. Who cares? The worst they can say is no. recognizing that you may have to sell yourself and kind of explain to them, this is what I actually can bring to the table or to the program. But we both have our limitations. So from the clinical side, I'm working with nurses. Sometimes I find, data analytics and strategic thinking, using data to drive change, and even surveillance definitions, because they want to think about a specific patient as opposed to a surveillance definition, which casts a broader net. So we're looking at a population. There may be gray areas, et cetera. We're not trying to give a diagnosis. We're just trying to put them in a category. So we're all counting things the same way. I think sometimes when you have that clinical mindset, it's harder to generalize that to a patient population. Whereas it's the other way around for those from a public health background. We can generalize it, but when it comes to specific disease processes, comorbidities with a specific patient, where they are now, where they're going clinically, sometimes that's difficult for us. So, I really believe that, we all bring our skills to the table to make a strong team. And that's what I hope everyone could recognize. There's not one specific educational background that's going to have all of the answers. But our goal is to put together a comprehensive team. But we should all be striving to be that well-rounded IP. I look at the APIC competency model, and I don't think it's just by happenstance that it's a circle. And every time I look at that, I'm like, they want a well-rounded IP. And they talk about all these different skill sets that we're striving to become experts in. And some of them I already have because of my education, and some of them nursing or clinical background has because of their education. But we all have deficits that we should be working on across our career. So,
well, that's interesting. Becca, has that been your experience as well? Because you come from a public health background.
It actually has been my experience as well. I also have applied for roles that were specifically asking for an RN, and had to sell myself in that role. And I think that that's been the experience of a lot of folks, but that is changing. Partly because nurses are hard to find as well. Infection preventionists are incredibly hard to find. We have such a specific skill set that it's very difficult to hire IPs right now. But I think Chaz is exactly right about this idea of a diverse team that brings folks with deep expertise in the areas of both clinical care, public health, and microbiology. And really the public health perspective of using epidemiological principles and tools to be able to understand what's happening in aggregate is a key thing, a key part of infection prevention that truly we've only touched the surface of. And I think we'll see more and more of how those epidemiologic principles can be used as our field continues to grow.
So let me ask you guys this. What would you say, and we're going to I'll direct this a little bit more, but you've got a college-age student or a high school student, because I believe there are data out there to suggest that people start thinking about their career or careers as early as middle school and high school. First, what would you say, Becca, are the great things about being an infection preventionist from your perspective?
I think you mentioned early on that every day is different. And if you like excitement and something new in a work environment, infection prevention is the job for you, because we're constantly preparing and reacting and responding at the same time. So I think that having that diversity in your workday and knowing that likely you're going to be learning something that you didn't know before. As you investigate, a trend or a disease that you've not had experience with, that can be very exciting. That idea of sort of continuous ongoing learning. It can also be a little exhausting. And I think that, you'll hear that from IPs that have been in the field a long time, that as much as we learn, there's never really a place, like with some careers, where you feel like you have learned everything. There's always more.
Is there a career out there like that? I don't know.
I'm thinking surgeons, but
I don't know.
But yeah.
Yeah, I don't know about, but good point. I see what you're saying. It can feel overwhelming, perhaps, to think there's, you're only scratching the surface, or the science is continually evolving, and so you're always needing to keep up. But yeah.
Right. Well, and we touch so many areas of the hospital, or the healthcare setting. And really, as we talked about expanding into schools and prisons and congregate care settings and gyms, et cetera, the amount of literature that's produced relevant to all of those different care settings, at this point, it's undigestible. There's so much, we simply cannot digest all of that. And so, part of the process is being able to sort of prioritize and really focus on the work at hand, and knowing that there's always more out there when a situation arises that requires a literature review.
Chaz, what about you? What would you say to someone who's pondering a career choice? What would you say would be your favorite thing about being an infection preventionist?
Yeah, so just a little bit about my personal journey. I always knew I was drawn to healthcare. I just wasn't sure in what capacity, and all I knew was a nurse or a doctor. And so that's where I started. I was pre-med, and I was going to go to med school and become a physician, but kind of learned about infection prevention almost at the end of my master's degree. And that's what we're trying to fix here is, telling people that this exists and it's a career path. So for me, it is a way to impact patient care without being the one at the bedside. So you're more of a support staff to not just people directly delivering care to patients, but also people who impact how the care is delivered, the environment in which it's delivered, et cetera. So if you're looking, to impact healthcare in a big way, no matter what the setting is, this is definitely a career where you can do that. And so that's kind of my draw to it.
That's great. So here's the other question. I think we've said it. If you're interested in becoming an infection preventionist, there's no specific area of study or degree requirement, at least not at present. And, Chaz, you mentioned even sort of your professional skills around project management and strategic planning and team building. All of that can serve the infection preventionist very well, regardless of the setting, because most IPs work in a team setting. I know there are facilities out there where you might be the lone infection preventionist, but you're working with other caregivers and hospital administration or your facility administration or your nursing home, et cetera. But let's talk, real practicalities of choosing a career, employability. What would you say? I'll start with you, Becca, about employability, because you know what your parents are going to say. Can you get a job?
Yeah, and I think although there's nothing written in stone currently about what background an IP should come from, I think when we look at what employers are asking for, when you look at job descriptions, typically they are going to require a background in either nursing, public health, or microbiology. Some employers will open that up a bit to other health science fields, but predominantly those three. The question as to whether or not you can get a job in infection prevention right now is a very loud hell yes, you can. It is very difficult to hire IPs right now because there are just simply not enough of us. And all of the sort of issues with having clear training programs in place is the reason for that. But I think that someone with, 2 years of background in infection prevention is incredibly employable and really can move anywhere in the US and really probably anywhere in the world, and find a career that's a good fit
Okay,
for
so that's
them,
good news.
which is kind of an exciting, yeah, no, it's kind of an exciting thing. I get, I'd say almost on a daily basis, notes from recruiters asking about, my interest in positions all over the U.S. And Chaz, I was actually going to ask you to forward me that cruise line recruit that you got, because that sounds amazing.
Yeah, that would be fun. A brewery would be fun for
That would
me
be
too.
fun.
I don't know, maybe. But Chaz,
Hmm.
what about, okay, so we've determined, okay, it's still employers are looking for background in
Hmm.
nursing, public health, or laboratory or microbiology, with likely in years to come, maybe more expansion of other healthcare and other fields. But
Hmm.
so we've determined that, now is the time, if you're thinking about a job where you can, you're employable and it's transferable, meaning, you're not tied to a specific location for a job. Chaz, can you share not your own salary, but do you have a sense of ranges of what IPs make?
Oh
Like, what are we
gosh.
talking? Get rich quick or comfortable
Um,
slowly?
I would I would say comfortable slowly, but
Okay.
I would also say that my hope is that once we really educate people on what infection preventionists do and just the scope of our work, all the things we touch, all the things we're responsible for oversight of, I hope that eventually it really will be reflected in the salary because there is a lot that goes into what we do, and we're asked to be experts in things that we actually don't physically do ourselves on a regular basis. So, for instance, to me, first things that comes to my mind is like high level disinfection. I don't reprocess endoscopes. However, I'm responsible for having oversight and validation of that area to make sure that they're doing everything appropriately. So, um, and oftentimes you'll find the person who is directly responsible for the area actually doesn't know the process as well as the IP is expected to know it. So, um, the salary is kind of dependent on where you are in the United States, how big the program is that you work for, how much they value infection prevention in their organization, the expertise that they're trying to draw to their organization. Um, you know, and again, my company is huge and they've invested lots of money into their IP program. So we have IPs at the corporate level, we have IPs at the division level, and we have IPs within each facility. So you really, if you want to be able to grow as an IP, like Becca said, you can go anywhere. But if you're looking to go to a company and stay with a company, you probably should look for something pretty big. So there's room to grow and to move into different positions and kind of climb a ladder per se. But I think that you can get to a place where you're making a pretty good salary, but it's going to take some time to get there. But I hope that, in the near future, again, as we educate people on what we do and the value that it adds, we'll see the salaries begin to reflect that a little bit better.
Yeah, I think APIC and work being done with the advocacy group Public Policy, and certainly at the state level, looking at how important infection prevention and control is for the viability of any facility, healthcare system. The work is critical. And with a global pandemic that who knows when that will be over and the next one comes, the work is important. And, I think that there's a lot to be said for careers that allow a person with life changes to be employable. And what I mean by that, and both of you suggested this, is the ability to work in one part of the country or world and have a skill that translates no matter where you go. The majority of infection preventionists are women, according to the data that APIC collects. I will say that APIC is working with other stakeholders to address more diversity in the field. And so I would just, I'll just say it, we're also looking to get those candidates who are underrepresented in infection prevention and control to consider this as a career, because we need that diversity. We need, more men. We need more people of color. We need people from rural communities, because I think that just makes us richer and helps support the work of infection prevention across all populations. So I'm not sure if that's something that's been brought up with the academic pathway, but I just said it. So so there you go.
I think it's a really important point, Sylvia, and I think that adding clarity and rigor with this academic pathway and a very clear career path is going to make it easier for folks that are interested in the field to understand how to get from point A to point B versus as Chaz and I both described, a path of sort of falling into infection prevention, finding out about it by happenstance, and being lucky enough to learn about the career. I think just that activity and that rigor is really going to make it much more widely available to a more diverse group.
Part of this relates to working with academic institutions and creating curricula around what is the fundamentals of infection prevention and control. Did I get that right?
Yeah, so what we're striving to do is say, hey, this is what APIC feels that this is the curriculum that would satisfy setting someone up for a successful career in infection prevention, and kind of creating a package or a model that universities can follow to ensure that their candidates and their graduates are prepared to walk into a job in infection prevention and at least get started. I'm not saying they have to know everything or have all this experience, but do you at least have the fundamental training? So for instance, a nurse goes through nursing school, but they probably never really hear about infection prevention until they get to the hospital. And then the same with public health. We learn about epidemiology, et cetera. But like I told you, I didn't know about infection prevention until my second to last semester of my master's program. So, if we can just catch them and prepare them. So for nursing, make up the deficits that they may need to start in a job in infection prevention. And then for public health, throw in some clinical stuff that may help them to succeed. I think we will have accomplished that. So we're just trying to say, what is a well-rounded starting point that we would want to see from graduates before they walk into that position, no matter what their previous educational background is. So that's kind of what we're striving for.
It's exciting.
Yeah.
Yeah. And we haven't even touched on certification. So once you do become an IP, certainly the importance and relevance of being a certified infection prevention and control is so important. But that's a whole other episode. But still tied to career development and portability and all of that. Yeah, I mean.
Mm-hmm. And Sylvia, we're actually utilizing the competencies of certification and the curriculum that we're building to ensure that as an infection preventionist completes a degree program, that they will be prepared to take the certification
exam. This is great. And I would just want to echo the importance of having a career that can be varied, that offers different opportunities in different settings, right? What if, both of you work in healthcare. Is it acute care, Becca, that you're in?
Okay. I work across all the care settings.
And how about you, Chaz?
Yeah.
Mostly acute care.
Okay. But let's say in 2 years you go, you know what? I want to work in long-term care. You could do it, right?
Yes.
Absolutely. And Sylvia, I have a member of my team actually that consults within the movie and or film industry. And just recently because of COVID, actually goes out on shoots and gets to travel and helps to ensure that things are done safely. I mean, how exciting is that? I think we're going to see a lot more of that.
That sounds cool. I mean, the cruise is cool too, Chaz, but
I'm already in Florida, so should I?
No, that's exciting. And I think if you're listening and you have someone that's pondering, where they want to work and what career they want to have, infection preventionist is something to consider. It's exciting. It's varied. It's important work. It's challenging, but what job isn't, right? So I can't thank you both enough for sharing some of your insights, sharing your story. Thank you, Becca. Thank you, Chaz. On behalf of APIC and its members, thank you for your work on this new initiative of the IP academic pathway. And for everyone out there, be sure to check out www.apic.org, the APIC competency model, and lots of other great educational tools. And stay tuned for more on how you can become an IP.
Thanks for listening to the 5-Second Rule, produced by the Association for Professionals in Infection Control and Epidemiology staff and the APIC Communications Committee, in partnership with Human Factor. Audio tech is Blake Alphen.